Wonderful. Welcome everybody to our next installment of Inside the Operating Room. Tonight, we're very happy to feature Dr. Aurelio Rodriguez. I'm Dr. Minerva Romero. I'm an endocrine and general surgeon here in New York City at New York Presbyterian-Brooklyn Methodist Hospital. I am on faculty at Weill Cornell Medical College. I'm also one of the founding members of the Latino Surgical Society. And on behalf of the founders, I want to give you a warm welcome and thank you for joining us today. The Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons, and today's event is in line with that mission. We'd like to thank our institutional members who have supported LSS, but also the faculty and trainees at their respective institutions by demonstrating this commitment to our mission. Lastly, we want to thank all of you, our members, for supporting and believing in the Latino Surgical Society. I'm very happy to introduce that during this webinar series, we're happy to have Dr. Ana Sofia Ore Carranza and Dr. Rick Babolisa as our new Inside the Operating Room directors. And we thank you very much for your efforts behind the scenes in setting up this academic year's series of Inside the Operating Room. We are also happy to introduce Ms. Natalia Correa, who's a fourth-year medical student at Florida State University College of Medicine. She's excited to be joining us as the newest LSS social media intern this academic year. Thank you, Natalia. So with that in mind, let's keep looking to move forward together. And we're gonna go ahead and get started with our webinar. If we can take the slide deck down. Tonight, I have the pleasure of moderating this session and would like to welcome Dr. Aurelio Rodriguez for this installment of our series. Dr. Rodriguez is originally from Chincha, Peru, a town 200 kilometers south of Lima. He attended San Marcos University in Lima, Peru, from which he graduated with a degree in medicine. In 1971, he began a surgical internship at the University of Cincinnati Medical Center under the tutelage of Dr. William Altmeyer. He did residencies in general surgery at Henry Ford Hospital and Pontiac General Hospital, an affiliate of the University of Michigan in Detroit. He completed fellowships in trauma and critical care at Shock Trauma in Baltimore and in cardiothoracic surgery at Wayne State University, also in Detroit. He has held professorships at the University of Maryland School of Medicine, as well as serving as an attending at the R.A. Adams Cowley Shock Trauma Center in Baltimore, Maryland. Upon his departure from Shock Trauma, an annual Aurelio Rodriguez Award was named in his honor and has been awarded each year since to recognize the best surgical fellow. Dr. Rodriguez also is well known for structuring an organization, the Pan American Trauma Society, an international organization dedicated to improving the management of trauma patients through exchange of knowledge and experiences between surgeons throughout the American continent. The society's inception in 1987, after which he was appointed the founding president and later served as executive director. He has shared authorships of nearly 200 publications, received various academic acknowledgements, including Teacher of the Year and other honorary awards. More recently, in 2017, he was awarded Peruvian Master Surgeon recognition, as well as in 2019, being inducted as a member of the Academy of Master Surgeon Educators by the American College of Surgeons. I am very happy to have trained also under Dr. Rodriguez. Es un placer invitarlo, doctor.
De igual manera.
So we're going to start by talking a little bit about your background. I know that I've shared a lot already, but let's talk a little bit more about where you come from. Why did you choose a career in medicine? And ultimately, what drove you to pursue a career in trauma?
Thank you. First place, I would like to thanks. It's an honor to be here with you guys and the Latino Surgical Society. I encourage you to continue this initiative because this society, I'm sure, will grow up. At the Pan American, we start many years ago, and now it's a big society. And the Latino Surgical Society has the reason to be the same because there are so many Latino surgical surgeons in the United States. I am from Chinche, small town, south of Lima, as you know, and I was born in a charity ward in a hospital, which is a new one now. The old one is destroyed. I didn't like to study very much in the elementary school and high school. So mysteriously, one day there was a big contest and the patio or the hospital, the high school, and I was selected to be representative of the first year of high school. Well, somehow I won the contest. And somehow a teacher of geography took me to his office and told me that I was different, like the football. I was the different, el diferente, you know. He said, you are going to arrive to places nobody else has arrived before, Aurelio. You are different. Nobody here is like you. So I was surprised, was shocked. I am different. I said, I'm not good looking, but I mean, why am I different? Anyway, but that took me to change my life because I started studying. I became valedictorian in high school. I entered medical school. No, everything was different because I started having confidence in myself. I said, really, I'm good? I didn't know I was good because that's how important are the teachers. Because teachers can make a difference between, can teachers say, you're a very good surgeon, you know, you have a very good pair of hands, you're going to be very high, very good. And that make a difference versus other ones say, you're so bad and you'll never be any place. Then you are destroying. So be careful what you said to people. The word has a lot of power. Well, the interesting thing, I went to the Navy and I married a lady who was a South American champion of athleticism, you know, but we're different classes, like soap opera, you know. She was a high middle class person and I was the son of a poor guy. So I eat in the kitchen, you know, like soap opera, like a Mexican soap opera. That was my life, you know, basically. But interesting, you know, I was in the Navy and I had the opportunity to sing to a dictator, a good dictator in my view, Velasco Alvarado, a general who ran the revolution expelling the American company of petroleum, the oil company, who was in Peru for 50 years, never paid anything. He kicked it out, and also he did a reform, agrarian reform and everything else. Well, they took me, I was in one of the ships, the doctor in the Navy, and the ship, okay? They took me to stand for the president, and the president liked it, I guess, very much. He said, ask me whatever you want. So I said, can you move me to the hospital? Because I'm here on the ship. Everybody is healthy on the ship, except, you know, what kind of diseases are the sailors. So he moved me to the hospital, and that changed my life because that gave me the opportunity to pass the exam, the SFNG. I have time to study. So that's destiny, in my view, you know. A dictator changed my life, sending me to the hospital. And thanks to that, I was able to leave the Navy because by law, once you are in the Navy after 3 years, you became a real officer and you cannot leave for 7 years. And probably after 7 years being there, I forget to go to the United States, I'll finish being a regular doctor in the Navy, a real admiral, but never be a surgeon. So another miracle. And finally, in my internship in Peru, I never did surgery. I like it to see surgery, but I never was thought I was going to be a surgeon. As a matter of fact, one of the surgeons in the main hospital kicked me out of the operating room because I couldn't tie a knot. So I was expelled for not knowing how to tie a knot. So I leave Peru without knowing how to tie a knot. This is good for the younger people who they say, well, I'm not that good, and don't worry about it. I didn't know how to tie the knot, and look how high I have arrived. So don't worry about that. You know, I arrived to the United States with Dr. Oldmeyer, who said to me, the reason I take you, he was the father of surgical infections in the United States, has a book, a surgical book. He said, I took you because I I went to Peru. I said, so much garbage. I wanted to know how a Peruvian doctor looked like. And I said, oh, thank you, thank you. I had to say thank you, what I can say. But this is the kind of thing Latinos sometimes, when we come here, we get, you understand what I'm saying? You have to accept the many things they say, tell you, and you have to say, yes, sir. Yeah, sure, of course. And then the rest of the story, I went to Henry Ford Hospital. It was only one American surgical resident. All were foreigners. Now it's the opposite. There is very few foreigners, all the Americans. In those days, the chiefs of surgery were all Latinos, and they treat very badly the Latinos. So the worst enemy of Latinos were not the Latinos, who instead to treat us well, they treat us bad. That shouldn't happen like that, you know. I always help another Latino, you know, when they ask me even recommendations. I don't know them very well, but you know, they need help. But no, sometimes Latinos are not like that. No, everybody's like that. And finally, you know, before leaving Peru, my sister has an accident. He died in a car accident, trauma. And when I arrived to Cincinnati, I saw an open chest resuscitation. And I said, what is this? And I was so shocked, excited. I never saw in my life an open chest resuscitation of the hands. I said, I would like to do that. And that's the beginning why I started thinking about doing trauma. My sister dead, the Navy, my sister dead, and then I entered to a hospital who they don't treat very well. I'm not going to mention the name in Detroit. And then I ended in the hospital Pontiac General, which I did a lot of surgery because all the body, bread and butter, you know, gallbladders, open in those days, you know, gallbladder hernias. We did even a hip replacement in a crazy hospital. It was 3,000 patients we operated. Even the patient didn't need it, we replaced the hips. But anyway, I did a lot of surgery. That's where I became a surgeon. And then after finish that, I compete to go to this hospital famous to do trauma. You know, it was start being famous or very, how you said, very popular, the specialty of trauma. And actually, I compete with another doctor, and I'm going to mention the name, who is very famous now in trauma, who has a name who sounds Spanish. Okay? So Cowley, who was the director, said, I need only one to speak, because it was a racial speak, you know, and they took me by mistake, you know. The other guy was so mad, went to the Mayo Clinic and then became the famous, I'm not going to mention name, with a book and everything else. Okay, so I became a fellow in shock trauma. And after that, he told me, go to do cardiac surgery and come back. So I went, I did 2 years of cardiac surgery, come back, and I stayed there for 23 years. I compete for the position with another doctor who was present as the chief. He won, and then he made me associate director. And then the rest of the story, you know, how I became, answer your question.
Absolutely.
Sorry, it was so expensive, you know, I tried to.
No, that's exactly what we're here to learn about. I'm going to ask a little bit. You told us about your education, and I want to, you know, acknowledge the loss of your sister, which certainly there are many of us in medicine that have been inspired by personal experiences within our families. Can you tell us a little bit more about the drive, I guess, to pursue medicine and trauma surgery specifically? We always ask our students and our mentors to look beyond a personal experience and be able to really fall in love with the field. What is it that you love about trauma surgery?
Well, medicine, I wanted to be a medical doctor because my father always pretended to be a doctor. He's supposed to treat everybody. He was not a doctor, but the people made fun of him because they call the doctor. He was not a doctor. So they make so many fun of him. I said, I'm going to be a doctor, so they don't make fun of my father, you know. But also I have a lot of acne, you know, and I went to a hospital to be treated with some creams or sulfamide cream. I smell like a devil, you know, sulfa all on my face. And I said, I had to find an answer to treat me. I never was able to find the answer, you know, but that's one of the reasons I entered medicine. And I entered the medicine because the guy who did the interview, I passed the written exam, was a psychiatrist who I saw in my paper, he said, you play guitar? Yes. So he played guitar. So the whole conversation was about guitar. So it's something, you are in the right time with the right place, and I have been, God gave me always lucky, I have been always in the right place in the right time. So, and then the trauma thing is something that shock trauma was the mecca of trauma. Being 23 years there, I obviously, and you have to learn to do trauma. There was 30 admissions a day, so you have to see a lot of trauma. So I did that. I started writing, you know. I am more ideology. I have ideas more than writer, you know. And I don't want to tell you, famous people never write. He just have the idea, and the rest of the fellows do the papers and they put their name there. I am more an idea guy. I know, let's do this, you know, and that helped me. And then, you know, I went to Mexico, and Hacienda Los Morales, a famous restaurant in Ciudad de Mexico, and a doctor Vaquero, and the group of the Mexican Cruz Roja, it's a hospital, okay? It's not the Cruz Roja Mexicana. And they invite me and say, Aurelio, why don't we create a society called the Pan American Trauma Society? I said, what? You think they wanted to do, you know, certain countries in the South America, they think, share, we know everything. We don't need to know. They're not going to teach anything. So I went and asked everybody in South America, do you want to have a society with all the Americas? Everybody said yes, except two countries. I'm going to mention a name, who told me, why don't we call it Confederation Latinoamericana? They love the word confederation, you know? So I say, why we have to have the Northern, the gringos? They say, well, the gringos, they are very organized people. They have systems that we don't have, and they have organization that we don't have. Yeah, you guys are very good, but they have something we don't have. Let's put together. And we did. And here at the Pan American, today, we have thousands of members, meaning, you know, don't pay, you know who don't pay, but the typical thing, the Latinos. And it's a great organization who we have books or conference and lectures and everything else. So that's the history of the Pan American, and history why I'm doing trauma. And I'm very blessed that I have been doing that since then. I'm retired, by the way.
What a tremendous journey. And I want to ask if you can share with us a little bit about mentorship. I'm going to come back to the guitar in a little bit, but I want to ask, you mentioned, right, Dr. Altmaier was one of the important mentors in your career. Did you have other mentors? And can you also share a little bit about why was he recommending doing a CT fellowship before coming back to join them in trauma?
Well, Dr. Cowley, he was a cardiothoracic surgeon. He was not a trauma surgeon. He has the idea from some British guy. He went to England, and they come and told Dr. Champion, very famous, the Champion score, where he brought him to America, and he said, well, why don't we have a place called Shock Trauma? Oh, he said, that's a very good idea. So they start shock trauma, and they start having patients accidents on the highway. It's only 2 beds. Was it 2 beds? They call the dead place because everybody go there, they die, because sometimes they didn't know very much about shock or die. But that's the beginning of shock trauma, okay? And then Dr. Carley has a lot of political connections, and the money, instead to give it to University of Maryland, was given to shock trauma. At one point, shock trauma received more money from the government than University of Maryland, okay? That's the reason why shock trauma succeeded, was political, was knowledge, and and by the way, 80% of the beginning doctors in shock trauma were all there foreigners like me. They were Israelis, they were Indians, they were different countries. Now, of course, it's different, you know, but in my days, the majority were foreigners. There was a doctor from Salvador, a very good neurosurgeon, you know, and there were doctors from different countries, but in Latin America, who work in shock trauma. So that's never have been said to the world, you know. The trauma started, you know, for people like me who didn't have my green card, that's another story, but we were protected by Dr. Cowley because Dr. Cowley was a friend of the Vice President Spiro Agnew. He didn't end it very well, but he said, you are protected, boy, provided you are with me, nobody will touch you. So that's another story of shock trauma, that many people who were there, we have problem with our visas. We couldn't go back to our country, but we could work there. Even 3 presidents without green card. That's another story. But the thing is that one story of shock trauma I would like to say very quickly is the lady who is in the back. I think I was a young attending, and the lady was in the motorcycle, in the back of the motorcycle, a guy who was married, not with her, and there's an accident. They brought her, he died. They brought her, and she is very sick. And those days, I remember they used to have the bag of saline, and you had to squeeze it to give it more push faster. There was there was nothing to increase and now no, it had to squeeze it. And probably I assume somebody squeezed it, forgot it was empty. He squeezed air, so produced air embolism. Patient has a cardiac arrest. So we opened the chest. I opened the belly, and I did massage. I defibrillated the heart. So much burn. It smelled like anticuchos, Peruvian hard beef, with cook smell, and the anesthesiologist fixed dilated. I say, okay, keep going. So after 15 minutes, 20 minutes, okay, that's enough. We stop it, declare her dead, and we left. She was dead. So half an hour, 20 minutes later, we come back, or 15 minutes later, to teach anatomy to the medical student. And because patient was open from here all the way down. In that moment, the towel started moving. The towel started breathing. And wait a minute. The towel, she heart started in my mom, back, and breathing. I called anesthesia. I said, she's alive. She is dead. She said 10:30. Wait, 10:40, she's alive. Put it back in the respirator. He put it back in the respirator. I closed her like a cadaver, with the baseball stick, the thing. It was she was going to die. Well, she went to the ICU, and the next day she was alive. She was writing she wanted Coca-Cola. She was alive. She was dead for 15 minutes at least, fixed, dilated, and no heartbeat, because she was hypothermic. And since then, I wrote papers about hypothermia. I believe, some Europeans believe more than Latin America. In the United States, they try to death, all this hypothermia. Yeah, but there is a point in hypothermia could be used the other way. People who get drowned, kids can survive. She was hypothermic. That's the reason why she became alive. She left. I call her my Frankenstein because she was alive. Then we realized the father was the director of the Navy Bethesda Hospital. Sent the chief of neurosurgery, chief of orthopedic. Everybody came the day. Nobody had explanation why she was alive except that she was alive. She went home. I never met her again. I'm sure she's alive, maybe. I don't know. But she's my Frankenstein. So I get interested in hypothermia and all other things that I said. I have many people who came to fix dilated, and you don't know, can be on drugs or something. You have, particularly they are young. If it's somebody my age with a brain, ping pong balls on the floor, you don't want to open the chest. But it's a young person, maybe he's not. I have other cases, fixed dilated, who went to college. Yeah.
Yes. And I guess that's part of why we say you're not dead until you're warm and dead.
Correct.
And definitely appreciate the clinical observations, how I hope the audience can really capture from you how very astute observations can really lead to important clinical findings. So I really appreciate you sharing that story with us. Can you tell me a little bit about obstacles? You've mentioned, peppered them here and there in terms of the visa, in terms of maybe not having come to the US with skills. What has been the greatest obstacle in your career advancement?
I'm telling you, I don't think so. For some reason, I think I have been very lucky in my life, uh, but luckiness also requires some uh, dedication and effort. That's why I tell my kids. I have one kid who is a swimmer, could be in the Olympic, but he never probably pushed him enough. And another one who is now representing, we're going to represent Peru and lacrosse, and I tell you, you cannot get anything coming from heaven and you expect it. You have to put effort, the sacrifice, dedication. Leonardo da Vinci has to do that. He was not that he from day to day he became famous. He had a lot of failures. I don't have those kind of failures in my life from this kind, but I have been very lucky to be in the right place at the right time. But I think perhaps all the people who know me know, Aurelio, but you work hard. Perhaps I thought that was the way to do it. And all these things that my acne, all these things propitiate me. I said my first girlfriend, I kissed the eye because I was already in medical school. How bad nerd I was, a nerd, total board certified nerd. But all this, if I wouldn't have that, those failures became me and exacerbate my desire to be better. So maybe there were good failures, that I have. And maybe if I have everything, I wouldn't be in this situation, like now.
If you could give your younger self any advice, what would that be?
I will tell you, if you really want to be a surgeon, at one point you want to be anything, in the medicine, one of my motto is from Napoleon. He said, the word impossible is not in my dictionary. And that's what I said. I have that in medical school hanging there, and despite all the things that the first girl who I thought was my girlfriend, and actually she was not, sent me a letter saying, I'm sorry, what I'm going to tell you is going to be disappointing. I am going to get out of the pedestal. And she was dating a married guy, but I was destroyed for that. My first person, I feel something like you got love, and all that things personally help you to move forward, not to go down. And as I said, I have been having all those things, and I tell my kids to have perseverance, dedication. The things don't coming from heaven, coming from heaven, okay, but you have to put some effort.
I want to really give you an opportunity. You shared a little bit about the Pan Am Trauma Society with us earlier, but what would you say your experience was? I think we really appreciate from Latino Surgical Society, we have been, we established ourselves about 5 years ago. I'd really love to hear some pearls from you on how can we grow as an organization and how can we stay true to the mission but continue to evolve.
Yeah, I think there is an organization called the FELAC. You are familiar with that? Federation Latino American Trauma Society. But they don't have, as far as I know, I give that idea many times, create a chapter in the United States, because there is a lot of Latino American surgeons who work here. But they belong to the American college, yeah, but they don't have this part of this organization, FELAC. I don't know if they have some chapter. Now you have already something better than a chapter. You have a society. So I guess the idea will be to use the marketing to market the society. I'm sure many Latin American surgeons don't know the existence, number one. Number two, it's all about connections. You have to have somebody who recommended. They say you heard about this society, young guys who have a good organization who trying to do better for all Latinos. In particular, probably will help with Latin American surgeons. You have to have a goal. For example, I would say the ones who just coming here, the new surgeons, young surgeons who come in from other countries, and they don't have anybody who to talk to and advise you. They say, what do I do, Dr. Rodriguez? I have a lot of people who call me, and I try to help them with my advice. But in the society, what are one of this, I don't know very well what or your organigram. How do you say this is our function is doing A, D, C, D? But one of that should be that. The other thing I would do that's I asking this to the Pan American. They don't listen to me sometimes because I am retired already. You need to have somebody who help you to teach you or help how to write papers. Okay, because many people has idea and write a paper but it's not accepted, you know. But I'm sure in the Latino society there are people who has write grants or know how to write papers. So that person, you can do it. We call it in the old days a mesa de trabajo. I don't know how they call it, and you teach how to write a paper. I'm sure there is many people who want to write it, but it's a shame to ask you, say, you know how to write it? I have this idea. Can you help me? You can have somebody, a group of people. And the other thing to help us very much was the congresses, the meetings. And we invite, of course, the Americans because they have somehow, you know how Latinos are. When they see a name that they recognize, very famous, they go, you know, to listen to this guy. Probably it's not as good as you think it is, but you love to see it. You take a picture with him, you know, with that. That is politics, you know, because that guy is going to advertise you. He's going to say, this is society. Do you not belong to the Latino side? Oh, yeah, I'm going to. You should, you know. So the next time, I don't know, you do congresses? Not yet. You have done congresses? You did. Your voice went away. Your telephone is
yes.
Not,
We did a symposium actually right before COVID in 2019. We hosted a symposium in Puerto Rico. Mm-hmm. It was a great event actually, but our planned event would have been in 2021, and we, because of the pandemic, certainly were unable to carry something out. We're looking to host one in 2023.
I think that will help because in those congresses, the problem with Latino, mostly will be for Latinos from the United States, because the Latinos to come from foreign countries, from South America, they have difficulty with the visa, you know, to come to the United States. They come for the college, I don't know how they do it, but this would be another example that it could be maybe doing something in addition to the college, something, so they take advantage, they come for the college and stay another day going to this special course, you know. You have to find it. You know what, you didn't even ask me before, but I always has ideas. So I'm sure I will come out something idea. I keep advising the Pan America what they have to do to keep growing, you know. We have a course called, in my view, as good or better than Atom. It's called DQT, Destrezas, Quirúrgicas, and Trauma. That course has so many videos, unbelievable. This doctor, Venezuelan doctor Otolino, now is stolen by the Chileans. He has spent his whole life filming all the cases, step by step, splenectomies, pancreatectomies, you name it. You are there. And they have, he has his side didactic guide. Well, you see this course, you fell in love with the course. And we're going to translate in English now, but it's in Spanish, you know. But a course like that, maybe giving him with you guys, attract some people, Latinos, to come to the course. You know, we can talk to the Pan American. They can allow you to use the course in your congresses, you know, the DQT. And we also, he's preparing another course. It's called MIPS, is Initial Management of the Trauma Patient. It's interactive, and you can go home and airway, take 3 classes or 3 sessions to finish your airway. And you have so vividly an open face, you know, with gargling. You even the anesthesia never have seen that, the anesthesiologist, you know, and you telling you what to do is interactive. So that's what the Pan American is doing, the creativity. And we are finding more young people who has ideas. It didn't occur to me. It occurred to me at the beginning in the Pan American, but now there's coming people with more ideas. What we can do for the Pan American? Sometimes we are lucky. We have Shock Trauma was our how do you call that? No mentor. How do you call that? The person who support you economically, the mecena. Mecena was Shock Trauma, Cowley. Then we moved to University of Pittsburgh. Then we moved to University of Virginia. Now, most of the society is supported by Virginia. You could be supported by some organization, they be interested for taxes purposes. They are donating to you guys a amount of money because you're going to need money for secretaries and to have a page and all that costs money. So you need to have some mentorship. Somebody, Mexico, the guy who own whole Mexico, maybe he likes to put his name to a special award, a special lecture with that name. That's what society does. Well, the college do that. Everybody does that. Because otherwise, you're going to think the support is coming from the members. We have a problem with this. So the members, 40% of the Latinos members pay the quota. Because the Latino always asks, "¿Qué hay para mí?" What's for me? I pay this, ¿qué hay para mí? The college charge them $300 and they sell the house to pay for the college. But the society who is a Latino, what? But I don't give this, I don't give that. Listen, what do you get from the other side? Why you don't complain? But this is our mentality. So you have to know. We will have a conversation, private conversation here. I give you some advices how to make the society flourish. It better know, and the best way to know maybe is to have even somebody who Shakira, somebody who, and then this is society with Shakira. It looks funny, but it's not funny. It is the way you get attention. You need the attention of the whole group of Latinos. And I know a lot of Latino surgeons, I'm sure you do too, but they say they're too busy, what are going to do? They give you 1,000 excuses. Come on.
Let's talk a little bit. I want to give the audience a chance. They have submitted a couple of questions, and then we're going to move into what we call the rapid fire questions. So from our audience, Jenny Garcia asks, "Good evening, Dr. Rodriguez. How did you overcome burnout during residency? And do you have any tips on how to handle mistreatment during residency besides hanging in there, or as we say, aguantar?"
That's a very difficult question, but very good question. In trauma in particular, there have been studies showing that the residents burn out. In surgery, I'm sure that is too, because the thing is that surgery is important, but in my view, I keep telling the resident, if you have family is number one. You cannot forget the family. You cannot sacrifice the family to just become a super surgeon, because then you have kids who you don't know, like my first family kids who I didn't know they play football at the University of Maryland. I didn't know that because I was traveling around the world, making me famous. And the second kids who I went to every game, every swimming, I was there because of course I was a chief, I have a lot of time to go. But I'm not saying abandon your surgery dreams, but you can have a balance between both of things. If you abandon your family life for surgery or for whatever, at the end you're going to be unhappy because you said, I could have kids, I could have this, no, I don't have that because I wanted to be a famous surgeon, And this is not my idea. This is for Dr. Richardson, who just died recently, the Kentucky guy. Mm-hmm. He talked about this, wrote a paper about this, how surgeons, we get crazy about trying to do this, and that's why the burnout comes, because you don't compensate, to a family life. It's possible to have it without, you have a wife or husband who is understandable. You're a surgeon, you have to be sacrificed. You don't marry a guy who wants you to be there to cook for him. Then you cannot do anything. But you have to find a way to compensate, and that's possible, okay? And the other thing is, that the surgeon should talk. And in other words, the guys who run programs should be mentors and talk to you, not only for surgery, but for your family life, it should be a mentor. And that is missing in the training program, Some surgeons talk, some others don't talk. Some surgeons, particularly women, go and talk to the director and talk about the problems she's having. And some of them are afraid to talk because they're going to think their weakness, that she's not good enough to be a surgeon. That's the old days, The surgeon woman has to walk like catch a scan, woman has to, if you know, wear makeup, those days are gone, Women are, in my view, technically, and now I'm teaching the DQT, and I'm surprised how fast they are, how good they are. They can do, technically, women can do better things than men that do. And by the way, that intelligence comes for the mother, not for the father. That's proof again and again. You are intelligent because you matter. That is something how important are women in our lives. So, answer the question that, and the other thing, the new technology and trauma, by the way, I have the idea to do something called, you teach a person how to do a splenectomy, okay? And give a lecture step by step with the pictures, the movies, and everything else. And then you close the eyes, and you keep talking again, and they are imagining what I saw in the movie. This is called cognitive simulation. You don't have to have money. That's the way they do in the Olympic champions. They teach how to swim, and they see the steps, and they are saying, and the guy closes his eye. When they call me for shock trauma or rupture aorta, I was rehearsing in my mind step by step. I had to drive 45 minutes. I did 5 cases, 5 aortas before I arrived. Okay, so when I arrived, I was flying because I already have done 6. So because in theory you have steps that you do. I had to do this, I had to do that, I had to do that, and then that. Well, that is called cognitive simulation. Has proof, that make you feel more confident. I think they should be part of the training. Cheap, you don't have to pay anything. You have to have the movies and the pictures to teach the resident step by step. For example, this could be something your society could champion. Training or skill. Look for somebody to do that, has like Dr. Tolino, and put it there and teach how to do a pancreatectomy, and then everybody will be checking, and instead to be 30 guys, will be 100, 200 guys following that, and close your eyes, and you have an audience. And suddenly they say, that the society has all these interesting things. Cognitive simulation, okay? It has been proved that produce more confidence. The surgeon will go enter like it's nothing new. He has been done how to do it. And actually, the future is going to be whatever it's called now, that move your hands and you think you're operating or not. Because the cadaver and the mannequin is too expensive,
Thank you so much for those pearls. And, it's funny because I think about some of the tips that I have given my mentees and the students, the residents I work with. And I always tell them, never leave the hospital, never go to sleep without knowing what you're going to be doing tomorrow. And it's really important. The preparation for your next day is really an essential part of being successful. So I appreciate you sharing that with us. I'm going to go ahead and move into the rapid fire questions. So what we're going to ask is if you can please just share with us the first thing that comes to mind when I ask these questions. We're going to try to get through them in quick succession. So what is your favorite city?
Asking to everybody or me?
You.
Oh, my favorite city at this point is Pittsburgh, because it's not as crazy as Baltimore. Baltimore's supposed to be my city, but it's crazy these days, too fast for me.
Okay. What is one of your preferences, distinctive preferences in the operating room?
What is my what preference?
A unique preference in the operating room.
Well, my favorite preference is when you have some assistant who help you to do the case, like when I operate with you. I like want to operate you because I knew you what you're doing. But it's very hard when you operate with somebody who don't have any idea what you're doing. So you had to tell everything, and that's what I remember you very well when we're doing those little hernias that we had problems with. Yeah,
I might be blushing.
I was trusting you. Yeah.
Absolutely. Thank you. Thank you for that. What is your favorite food?
Well, my favorite food is the Peruvian food. My wife doesn't cook because she works until late, and so I eat my antioxidants, a box of antioxidants, broccolis, and stuff like that. I'm living on antioxidants, thinking that I'm going to prolong my life, my telomeres, and all that kind of stuff. So my favorite food will be Peruvian food. The Peruvian food is unbelievable. Unfortunately, I'm a cheapo guy, so when I go to Peru, I cannot go to a restaurant where they sell that because my wife said, "What's the point to come here? You don't want to spend money, because I am spoiled. Because when I go, they pay for everything. When I go for my own money, I don't want to spend money. That's a problem, okay? But I think Peruvian food is considered one of the best. Mexican food also has such a variety of regional foods. It's delicious. Yeah.
What is your favorite thing about the surgery, or what do you miss the most about the operating room?
Well, to be honest with you, I miss being a trauma surgeon, being a cardiac surgeon before, for 2 years only. The adrenaline, anyway, that you are subjective when you have a problem, you have to make a decision to solve the problem quickly. That's the reason I retired, because I noticed they used to call me Speedy Rodriguez, Speedy Gonzalez. Even when I already went to sign, I noticed my speed was not the same like when I was younger. And this is the problem with some surgeons say, "I want to die in the operating room." Yeah, but you're not the same. You think you are the same, but then I saw me in the movie, said, "God, that's me." I mean, I look like Bionic Turtle, I was really faster. But you have to recognize a time when it's time to retire. You can keep teaching and doing some minor surgery with somebody who can do the majority of surgery, but it's not the same. You have to recognize it's time when it's too time to slow down and quit.
Is there one thing that you do every day, like a force of habit? And if so, what is it?
Well, because I'm crazy about survivability, I had to walk my 5 miles, do my weights, because all people has a atrophy of muscles, and I trying to look myself saying, Jesus. And now when you have one tooth broken from your denture, then you're in trouble, because at my age, almost 80, I'm not going to have implants, and pay $5,000-$6,000, to be burned when I'm dead. So you have to be careful. So conclusion, is my walking, my exercises, and I trying to do mindfulness. That's what my wife always said. "Why are you acting like that? Why are you going to use mindfulness?" Yeah, it's easy to say. I advise everybody in the store how to do mindfulness. Don't be critical. Think things for all the good things. Live in the present, not in the past. Everything. But I don't do it like exactly I said. I preach about that. I am a master preacher. Everybody thinks, "Oh, you are marvelous. How do you know to that?" Yeah, but I wish I can do that like I'm preaching. And that's very important, mindfulness.
If you had a different path and were not a surgeon, what other profession would you have approached?
I'd probably be a teacher. I always like to teach. The way I entered the medical school is my father bought me a passport, the dark piece of cardboard and painted black and chalks. And I explained by explaining people. And I memorized the book of chemistry and physics and all that in high school. That's why I had the highest notes, because I have a auditive this memory, So I like to teach. Sometimes I teach with comedy, which can get me in trouble too, because sometimes you have to be very sensitive these days, whatever you said, And I got in trouble. You probably remember. So I get in trouble for saying things I shouldn't say, There was no bad intention. It's that it's a different era where I live,
Absolutely. Last question, what is the best gift that you have ever received?
Well, I don't know. I see my kids, I guess, I have been gifted all my kids. They're all doing well, some better than others. And my guitar was not a gift. I bought a guitar and $400 when I was a resident. $400 was a lot of money. It's because I play the guitar and I sound like this is unbelievable. Was a guitar called Hernandez, was made in Japan, was a copy of a Spanish guitar. And now after that guitar, one day I give my kids were scratching things, and one says, you know how much your guitar costs now? $7,000. So I don't let them touch anymore my guitar, $7,000 guitar. No wonder it sounds so good, because it was really amazing. This is, I have here my guitar. I'm trying to fix some certain thing, but somebody say, you fix it, that's not original anymore. You cannot charge $7,000. So again, my wife is telling me to die to sell the guitar, for $5,000. But anyway, that one good gift in my family is a good gift.
Absolutely. And I did say that I would come back to the guitar in an earlier portion, but I noted that you had two very important, I would say, transitions in your life that came about in some relation to your ability or hobby or love of playing guitar. I guess, can you comment to close this out on the importance of maintaining some hobbies outside of medicine and surgery and how you have been able to connect with people through that?
Very important. I think the guitar has helped me not only to enter medical school, I think, but I play guitar because I guess I fell in love with my first degree cousin. She didn't pay attention to me, and I tried to see maybe she's going to pay attention. She never did, and she still didn't marry. And but I'm not a guitar player, but I know how to accompany my sing. So I can sing playing with my guitar. People say, "Oh, you play your guitar?" No, I just play for accompany myself. But I've been, as you said, in moments I have a stress out, I get my guitar and I play. So it's a good to know instrument. In addition, to play an instrument is very good technique to avoid Alzheimer. Is walking. Better than walking is dancing, because dancing requires oculomotor coordination. The brain is stimulated. Or play an instrument, because I play an instrument, that coordination of my brain keep active. So and a siesta 20 minutes a day, and use your hand from the other non-dominant hand. Those have been proved to decrease the amount of Alzheimer. So the guitar, very good. It has me taken to many places. I sing for dictators. I sing. Nobody say me that like Julio Iglesias underwears to me. They send me flowers when I go to South America singing. And of course, my wife doesn't think I sing very well. She says, nothing is good, you're not prophet in your own land, everybody says, oh, right, you're very good. Yeah, my wife says, it's okay. But she likes to hear those rock guys who I said, he's not singing, he's screaming, the guy is not singing, but she thinks he's great because he has a long hair and whatever. Anyway.
Okay, well, I want to be respectful of your time, and I really appreciate it. Muchas gracias. Thank you for joining us, Dr. Rodriguez, for this installment of our Inside the Operating Room webinar series. I do want to thank our team who has helped behind the scenes, and I want to thank our audience for tuning in. We will make this video available on our YouTube channel and our social media channels soon after our session tonight. If you are interested in learning more about the Latino Surgical Society, you can follow us on all our social media and go to our website, latinosurgicalsociety.org. I also want to ask you to tune in September for our next Inside the Operating Room episode. If we can bring that slide up, we will have our next speaker all the way down from South Texas, Dr. Dan Albo, who will be joining us from the University of Texas, Rio Grande Valley. And with that, I want to close this out. Muchas gracias. Thank you so much for joining us, everyone.
Muchas gracias.